right, I got to your question before you even asked it. Tesha, I apologize if I butcher anybody's handle or name here. All right, so we'll get started here, and we'll do some questions that are, they'll warm up the brain. All right, they're not terribly difficult, but I usually use these first 5 minutes just for anybody to shout out any wins. Has anybody taken the exam? We can cross our fingers for you, or you're about to take the exam, or maybe you took the exam and you're just dropping in and tell me that you passed. All right, I love those. I did a few study plans for folks today, or not today, but over the last few days. Probably done about 5 or 6. So if you're interested in a custom NCLEX study plan, that's that's the main thing that I offer, and you can access it through the link in my bio. Go to my main page, go to the link in my bio. Okay, they are $25. All right, it is cheaper than taking the NCLEX again. Okay, and basically what it does is it gives you a structure. Okay, and it gives you a plan, what to study on what day. And if you are a repeat test taker, it focuses on your weaknesses. Okay, your candidate performance report. Oh, thanks for that comment, Grace. Grace said, just would like to recommend to anyone who hasn't invested in one of his study plans, go do it now. Thank you so much. That means a lot. So you can go to the link in my bio and access that there. Okay, thank you guys for all the likes. The likes also help get this in front of more people's For You page. So I appreciate that. All right. Emily, good to see you. Emily is a recipient of a study plan, and if I remember correctly, I think your NCLEX is coming up not too long, right? Like a week or something. So, all right. So we are going to be doing, thanks, Hamdi. Emily says she takes February 10th. So I do these lives every Sunday, Tuesday, and Thursday at 9 p.m. Eastern. Okay, so you can pretty much set your watch, your calendar, Sunday, Tuesday, Thursday, 9 p.m. Eastern. Okay, all right. So the background's here for a minute until I put up the questions here. Yes. Test on the 14th. You got this. You got this. And it's not too late, friends.lover there. If you want to do a study plan for your second attempt, you absolutely can. Okay. 14 days is a decent amount of time. It's probably I wouldn't say the minimum, but I feel like it would still be a benefit to you. Okay. And you can access that through the link in the bio. Okay. All right. So unless we have anything else, let's jump into it. Okay. So I've got some cardiac and cardiac pharmacology. All right. Lisa, well, let's make it a good one. Okay. Let's make it a good one. Do you want us to give comp results or a practice test when purchasing? There's a section, if you are a repeat test taker, there's a place to input your CPR info. Otherwise, there's a blank down at the bottom where you can add anything else that you want that's relevant. So like some previous test issues, or you can also email it to me separately at nursejimmyofficial@gmail.com. Okay, and I'll include it in your plan. Okay. All right, fantastic, guys. Let's get started. What do you say? All right, we might jump around a little bit in this question set. We'll start off with some easier ones. Stand by. Let me pick the correct thing here. Okay, so once I put this up, I'm going to resize it, and then you guys chime in the chat if you guys are new. Just drop your answer down below. We do today will not be a case studies live, but we have done them. We have done them in the past. Make it a tinge bigger, sure. How's that? Let me see. We are actually going to be doing some case studies on my Tuesday live. Okay, so I posted my schedule for topics in my story for today, and there's also a kind of a photo video that's on my feed, which has the topics for this week. Okay, so check that out. All right, so we are just going straight into question 1, and yeah, like I said, guys, these first few, we're just warming up our brains. So yep, the correct answer is going to be C, right? Because any new hypotension with altered mental status signals poor perfusion. Okay, maybe cardiogenic shock or some sort of malignant dysrhythmia risk. All right, so that is going to be the finding that requires a nurse's immediate follow-up. All right, good job. All right. Okay, a nurse is caring for a client with chronic stable angina who's prescribed sublingual nitro-PRN. Client reports 6 out of 10 chest pressure while walking to the bathroom and sits down. After the first nitro tablet, the client says the pain is still there. And the nurse notes some vitals. Which action should the nurse take first? Which action should the nurse take first? All right, Clat says B. Morgan and Audia say A. Mishu says B. Okay. This is, okay. Oh, Kelsey, good to see you. All right. Well, we found our first good one here, where we seem to be split mainly between A and B. Okay. So let's talk about it just a little bit here. Okay. So basically what's happening here, we'll look at, for those of you who said B. Okay, so B is going to be incorrect here. Okay, and why is that? Because in the question, the client has new hypotension. Okay, 88 over 54. Well, we know that's low. Okay, nitroglycerin is a vasodilator, so it's going to drop that blood pressure, right? Okay, yes, they have stable angina, but their blood pressure is not stable. Okay, so the correct answer here is going to be A. We need to have them lie down and reassess blood pressure before giving another dose. Okay, so make sure. I see a lot of you saying, "Oh, I misread the question," or I went too fast. So you only get one chance on the NCLEX. Okay, so just really make sure you read through the full question, know the detail that's there. Okay, and understand the side effects of the medication. Okay. All right, fantastic. So let's go to question 3. I'm gonna bring this down a little bit. I feel like it might be behind some banners. Okay, appreciate all the likes, guys. And if you're new here and haven't already followed, feel free to do that up here. Again, we do these lives every Sunday, Tuesday, Thursday at 9 Eastern. All right. Let's continue warming up our brains here with a little select all that apply. Okay, so client with new onset AFib with rapid ventricular response who was started on IV DILT, and then 30 minutes later the client reports dizziness and feels faint. There's their reported vitals. Which nursing actions should be taken? Okay. The answer to the last question was A, right? Have them lay down, reassess blood pressure. All right. Okay, so Clat chimes in. First one with saying A, B, and D. What else? Jennifer agrees. Okay. All right, good job, guys. No, this is good. I was hoping sometimes these select all that apply really kick y'all's behinds, but not this one. All right, so yeah, answer here, guys, is A, B, and D. Absolutely. The reason C is not going to be included there because orthostatics can worsen hypotension. Okay, and UAP delegation here is going to be unsafe. All right, especially when the client's unstable, the RN should not step away from this symptomatic hypotensive client, right? Okay, and then E is going to be incorrect because ambulation with that blood pressure makes him a fall risk. Okay? All right, A, B, and D, good job. All right, let's see what else we got here. All right, question 4. Nurse is caring for a client admitted with acute compensated heart failure who's receiving IV furosemide. The client reports new palpitations and lightheadedness. Telemetry shows frequent PVCs. And the nurse notes the urine output's been high. Which lab value is most important for the nurse to review next? All right. Okay. Nico says they are taking their NCLEX on Wednesday. Good luck, buddy. Good luck Wednesday. So tonight you're doing great by being here. So awesome job. Stick around. Tomorrow get some rest. But maybe early on, check out my NCLEX review playlist right here on TikTok. It is, you go to my profile, scroll horizontally through my playlist, check out the full review, okay? Might take an hour and a half to 2 hours to get through it, but do it in the morning. It's a good little fresh review with some quick reminders, okay? But get some rest, eat good food, okay? Definitely make sure you get 8 hours of sleep. All right, so yeah, guys. All right, we know that IV Lasix, we pee out a lot of stuff with regards to these electrolytes, but this is basically saying which electrolyte is most important, okay? The answer is D, right? That potassium level, because we know furosemide is not a potassium-sparing diuretic, so we are losing potassium. This client is losing potassium, and we can remember potassium begins with a P. Potassium pumps the heart. Okay, any low potassium or high potassium could result in lethal dysrhythmias. Okay, so if there's an answer and you feel like, well, goodness gracious, it could very well relate to their potassium, the answer is probably potassium. Okay. Okie doke. All right, so let's jump down. Let's see what question 6 is here. Okay. Nurse is caring for a client with chronic heart failure who is started on an ACE inhibitor. The next morning, the client says, "My lips feel thick," and the nurse notes mild swelling around the mouth. Lung sounds are clear, SpO2 98% on room air, but the client reports a tight feeling in the throat. Which action should the nurse take first? All right. Yeah, guys, because this question is basically getting at, okay, again, are you a safe nurse? Are you going to be a safe nurse? We need to recognize that lisinopril, the main terrible side effect that sometimes comes with it is this angioedema. Okay, so how do you handle that based on these answers that are provided? Absolutely, we are going to do C. Okay, we are going to perform that focused airway assessment, okay, because we know ACE inhibitors can cause angioedema. Okay, so any lip or throat swelling requires immediate airway focused assessment and escalation, because when they go downhill, they're going to go downhill fast. All right, you're just going to see that O2 on the monitor dropping. They're going to not look good, and it's really scary. It's really scary. I had somebody not with this, but not with the lisinopril, but I had a patient have a severe allergic reaction quite a few months ago, and it is terrifying. So you need to be ready and need to know these side effects. Make sure you're doing your 6 rights, checking your patient's allergies. Okay. All right. So let's keep going down the line here. Let's jump to 8 here. Select all that apply. Okay, so a nurse is caring for a client with symptomatic bradycardia who is prescribed metoprolol for rate control of AFib. The client reports fatigue, near syncope, and, quote, can't keep my eyes open, and telemetry shows sinus brady. The nurse is reviewing contributing factors before the next dose, which findings should the nurse recognize as increased risk for beta blocker-related bradycardia. All right, so select all that apply here, guys. Select all that apply. All right, so far everybody's guessing one answer. I'm going to tell you this now. It's more than one answer, okay? What else you got? We got C and B, C and E, B and C. Okay, this seems like a good one to screenshot for later. All right, Kelsey says A, C, and D. Okay. Kaisha says B, C, and D. All right, so we got a little bit of everything here. Basically, nobody has said anything related to E. Okay, I would say that that's a win. Good job, chat. E is not part of the correct answer group. Okay. So let's go through this. All right, so here we are assessing. This question wants us to assess. We need more information. Okay, so let's go down. Let's start at A. Okay, so A is correct. Okay, A is part of the answer. Right, because combining beta blockers, okay, with any non-dihydropyridine calcium channel blockers like DILT, okay, increases the risk of bradycardia or some AV block. All right, so A is part of the answer set. B is wrong, okay? Asthma is a concern for bronchospasm. Okay, especially those non-selective beta blockers, but it does not directly explain bradycardia risk, okay, that this question focuses on. All right, so B is not part of the correct answer. So far we just have A. All right, let's look at C. Baseline heart rate trending in the low 50s over the last 12 hours. So yes, C is correct. So a low baseline heart rate trends to predict intolerance. All right, that further dosing then can worsen symptomatic bradycardia. All right, so C is part of the answer set. So far we have A and C. All right, let's look at D. And D is acute dehydration from vomiting and poor intake. Yes. All right, so D is also correct. So dehydration can worsen hypotension. All right, it can also amplify dizziness and syncope symptoms, okay, with those rate-limiting meds. So the correct answer to this question, guys, is A, C, and D. All right, so if you got that, give yourself a shout out in the chat. All right, no, E is not part of the correct answer group. All right, so good job. Good. All right, let's see here. All right, let's go through. Was that 9, 10, 11? Oh. And Murray says, I failed my NCLEX, unfortunately. I think I was borderline. I'm sorry to hear that, man. That is, it's tough. It's a tough, that feels very defeating. And I'm sorry you had to go through that. But know that it's just a detour, okay? It is not your final destination here, okay? Just keep plugging along. If you want, again, send me a DM. I would say that, Amir, send me a DM and we can talk, okay? But I did see somebody else say that they passed. Season, love your live, passed at 85 questions. Oh, that's awesome. I'm so happy for you. That is fantastic. It's fantastic. Thank you guys for all the likes and follows. Yeah, definitely send me a DM and we can talk, okay? If you guys are finding this valuable, there's about 275 of you in here. I would challenge you all, if you find this enjoyable and worthwhile, do me a favor and repost this live right now. All right, do me a favor and just repost. That would go a long way in getting some more people in here. All right. All right. So question 11. Here we are. Which assessment is most important for the nurse to prioritize next? All right. Thank you guys for all those reposts. Appreciate that. All right. So correct answer here is going to be B. Perform a focused airway assessment and review pulmonary status trends. Why? So why is that? Okay. Amiodarone can cause pulmonary toxicity. Okay. It can cause, so that worsening cough is a high stakes cue here. So we need to pay attention to that. Respiratory compromise really does outrank any sort of cosmetic or vision changes with respect to immediate danger. Okay, so B is the correct answer. I don't know that I really saw too many other answers, so good job, guys. All right, let's go. Oh, what are we at? 9:23. All right, let's get a little deeper into my question set here because I don't know. I liked some of these other questions a little bit more. Okay. Let's start here. Let's look at 19. We might jump a little bit around, get crazy. All right. So, client arrives with weird fluttering in the chest, feels lightheaded. The monitor shows an irregular rhythm. Okay, and the client's pulse varies in strength. Which data is the most important for the nurse to obtain next? Okay, an irregular rhythm. What's a common irregular rhythm? Drop it in the chat. What is a common irregular rhythm? AFib, that's right. Okay, so 19 is the question. All right, so which data is the most important for the nurse to obtain next? Answer is absolutely B here, okay? So whether the client is currently taking an anticoagulant and when the last dose was. So an irregular rhythm, that is a tongue twister, okay, does suggest AFib. All right. So anticoagulation status is going to directly change, what is their risk of stroke? Okay. If they haven't taken their, apixaban, their stroke risk might be quite a bit higher, or if you're having to plan for a procedure, you need to know if this person's anticoagulated. Isn't a flutter regularly irregular? No. Flutter is regular. Flutter is a regular rhythm. Everything is very equal, really, for the most part. You got that sawtooth, and the QRSs are usually equally spaced. But yeah, irregular. It's like your heart is just doing whatever the heck it wants. There's usually no P waves. Okay. All right. Fantastic. Let's go. Let's do, I wanted to jump back. Yeah, see, we're jumping all over my question set today because I'm using my time wisely here and picking some questions I like better than others. All right, now that your brains are warm, let's do some work. What do you say? Okay, what do we got here, guys? So which findings should the nurse teach the client to report immediately? Okay. All right, select all that apply, guys. Select all that apply. Okay, we're getting some answers popping in. All right, after you pop your answer in, if you are not already currently following, thank you, Shop Girl. I would encourage you to follow. Again, we do these lives 3 times a week, Sunday, Tuesday, Thursday at 9 p.m. Eastern time. So definitely hit that follow button if you're not currently following. Ride to thank you for the follow. Appreciate that. All right. So 18. All right, select all that apply. Let's go through. Let's look at A, right? A is going to be correct. So we're talking about rapid weight gain does signal fluid retention and worsening heart failure. Okay. B. Okay. B is incorrect here. So a chronic unchanged mild cough, no. It's lower urgency than any acute perfusion or airway red flags. Okay. So you said what's HFR, EF? Basically, just know it talks about the exact abbreviation. High refractory ejection fraction. I know that EF is ejection fraction. So when you see heart failure, yeah, HF is heart failure. I think related to ejection fraction, and it's basically just a measure, a percentage of how well your heart contracts. So if you see that, just know they're talking about heart failure. Okay. Yeah, your normal ejection fraction 50 to 70. Heart failure reduced ejection fraction. Awesome. So yeah. All right, so weight gain, A, that's part of the answer set. B is not. C is part of the answer. So new near syncope can indicate like hypotension, bradycardia, dysrhythmia from meds, or worsening heart failure. So yeah, C is part of the answer set. D is also correct. So lip, tongue swelling suggests angioedema. That's an airway risk. Okay. So D is part of the correct answer set, and so is E. E is correct. So persistent heart rate in 40s with symptoms suggest that there's probably some sort of clinically significant bradycardia, all right, or over medication, or some sort of conduction disease. Who knows, right? Okay. All right. Does that make sense? All right. Let's see. See, I'm going all the way. I'm going all over. We're going back to 16. Here we go. All right. A nurse is caring for a client with chest discomfort who suddenly becomes more anxious and can't get comfortable. The nurse notes BP is trending down. Okay, and heart sounds are quieter than earlier. Which new finding requires the nurse's immediate follow-up? Okay. So far, I've seen a lot of C's. All right. Looks like the majority answer here is going to be C, and that's going to be correct, right? Because JVD, all right, with following JVD with that falling BP and narrowing pulse pressures definitely points to some sort of obstructive physiologies. So their perfusion is definitely worsening. All right, this is more immediately life-threatening than the typical inflammatory chest pain or any sort of non-specific nausea. Okay? All right, that's all right. Yeah, just slow down though. Slow it down. Okay? Let's see. 21. All right, let's go to 21. Okay. Here we go. All right, a client with chest pains prescribed Afrin and a P2Y12 inhibitor. Okay, the client says, I'm clumsy and bruise easily, so I'm going to stop one if I see bruises. Which instruction is the best priority? Which instruction is the best priority? Which instruction is the best priority? Okay. Pretty much everybody's saying A, and yeah, that would be correct. Okay, so reporting black stools is going to be important here because that dual antiplatelet therapy prevents stent thrombosis. Okay, so the key is recognizing dangerous bleeding signs and avoiding any unsupervised discontinuation. Okay, so minor bruising can occur, but those life-threatening bleeding signs, yeah, they need to know. Okay, that requires urgent escalation. All right, thank you guys for sharing the live. Thank you guys for the follows. All right, let's just jump into, let's see what this one is. I haven't looked at this one. All right, 24. A client with heart failure is prescribed furosemide and an ARB. Okay, the nurse wants to prevent predictable medication-related complications. Which assessments are most important to trend? All right. I'm seeing A, B, and E, A, B, and C. Kelsey says A, B, and E, A, B, and C. Jennifer says A, B, C, and E. All right. Let's go through it. I think you all pretty much agreed on A. Yes, A is correct. So weight is the most sensitive practical measure of fluid status change. So yes, A is part of the answer set. B is also correct. Okay, so loop diuretics can lower potassium. Okay, ARBs can raise potassium. All right, both directions matter, as you know. All right, C is also correct. So ARBs and diuresis can affect renal perfusion. Something to keep an eye on. So creatinine trend here is going to be key. All right, your creatinine is roughly like 0.6 to 1.3. Okay, it varies a little bit. And then D is incorrect. Okay, so D is not correct. Glucose monitoring is not the most direct predictable complication target for these meds. All right, and then E is also correct. So good job. I know, I think I saw Jennifer was the first one to get the whole answer correct. So good job to Jennifer and those of you who got it. So E is correct. Both meds can lower BP, okay, orthostatic symptoms, identify perfusion risk. All right, and then also subsequently fall risk. All right, so good job. All right, thank you guys. It was A, B, C, and D, okay, A, B, C, and D. All right. Is Maram here currently? I know we're not at our 20,000 likes yet, and she is normally the driver of that. Oh, there she is. You haven't called out. Yeah, see, Emily was looking for you too. All right, Maram, you better get busy. Yeah, rally the troops here. I think you outdid yourself by getting, I think it was like over 50,000 likes last live, okay? All right, so yeah, the answer here was A, B, C, and E. So we will move on here. All right, let's look at this one. We haven't done this one yet. 23. Client on heparin says, my gums are bleeding when I brush. The nurse also notes new small bruises on the arms. Which assessment is most important for the nurse to prioritize next? All right. Yeah, absolutely, guys. We're not going to waste too much time on this one. Yeah, absolutely. C, check for additional bleeding. Okay, gum bleeding, new bruising. Okay, that all suggests anticoagulation effect may be excessive. So your immediate priority is focused on doing a good bleeding assessment. Okay, reviewing monitoring results that guide possible dose adjustment, right? Okay, let's jump down here to 28. Let's see what's up. Okay. A client on clopidogrel says, I take omeprazole every day. The client asks if it matters. Which response is most appropriate? I like this question. I like this question a lot. Okay. All right. Didn't trick you guys, though, did it? Overwhelmingly, you guys are picking E. Jennifer says C is brutal. Take both together with grapefruit juice. That is, that's the kind of advice that'll get you fired. All right. All right. So yes, E is the correct answer. Clopidogrel is is a prodrug. Okay, so certain PPIs can reduce activation and potentially reduce antiplatelet effect. Okay, so the safest teaching here is not to self-stop, but to coordinate, okay, with the provider. Okay? What are y'all saying in the chat? Exactly. See, how fast do you want to kill your patient? Yeah. All right, 29. Let's see, which direction is 29? There it is. Okay. This is my question bank. All right, 29. A nurse is reviewing a client's home med list before administering digoxin. The client also takes a loop diuretic and reports my appetite is off. Which findings should prompt the nurse to hold digoxin and follow the plan for escalation? Select all that apply. Select all that apply. You're welcome for pronouncing your name correct. I'm a good name guesser. Okay. I'm seeing a lot of A, B, and C. Some folks throwing D on the end of there. All right. So, yes, the correct answer here is A, B, and C. Okay. I think pretty much everybody got A, B, and C. Some just added D on the end. So let's look at D. So D is incorrect. Okay. So mild dependent edema doesn't itself signal digoxin toxicity. Okay. That's not a sign of digoxin toxicity. So that's not going to be part of the answer set. I don't think anybody put E in there, so I'm not going to explain E. But yes, A, B, and C. Looks like you guys all understand why A, B, and C is part of the correct answer. So good job. All right, and thank you for the follow there. All right, 30, a client with a new stent asks, can I stop my antiplatelet if I'm getting a dental cleaning? Which response is the best? Here we go. So, looks like the majority of you are jumping on the C train here. Let's see. So we are teaching for sure, okay? Our very stable, boring patient. Those are the only ones we teach. And yes, the answer is going to be C. So C, yeah, premature antiplatelet interruption after stenting can cause what? Okay, it can cause thrombosis. All right, so the safest teaching is coordination. You got to balance bleeding risk and clot risk, okay, with the prescribing team. Okay? All right, good job. I think pretty much everybody got that one. Let's look at 31. A client with heart failure receives IV morphine for dyspnea and becomes more sleepy. Respiratory rate drops from 20 to 11. SpO2 is 94% on 2 liters. What's the most important next data for the nurse to obtain? Denise, thank you for the follow. Guys, if you're just jumping in, we do these lives 3 times a week, every Sunday, Tuesday, Thursday at 9 p.m. Eastern. So if you're not already following, would greatly appreciate it and think it would be beneficial to you if you're studying for the NCLEX or if you're in nursing school. A lot of good, even nursing school related content and review here going on. Okay. Yes, thank you guys for the follows. All right. So I'm seeing B and C. Archimoa, thank you for the follow. All right. So question 31. We are going to be assessing here, right? So what's the most, we're talking about data. All right. So we are assessing. And the correct answer here is going to be B, right? Sedation level and ventilation effort. So we know that opioids can depress ventilation, all right, before the oxygen saturation falls. So we need to trend the sedation and ventilation effort. Okay, it's going to be the highest yield immediate safety data there. Okay, so B is your answer. All right, 32. Client on heparin infusion needs a blood draw and is anxious about too much blood being taken. All right. How many people see this? Oh, you're really taking a lot of blood there. You gonna leave me any? Which nursing action is most appropriate? All right. Which nursing action is most appropriate? Yes, good job, guys. Yeah, the answer is C here for sure. Yeah, anticoagulation monitoring, it's got to be accurate, right? Sampling techniques affects results and the line safety. So we need to use correct sampling method and reducing unnecessary draws. All right, good. I don't think anybody really got that wrong. So let's just keep it rolling here. There's 33. All right, client on IV furosemide. Has improved breathing, but now reports my legs feel weak. Which finding should the nurse treat as high priority to trend during ongoing diuresis? Okay. Your legs feel weak. And this is a select all that apply. Select all that apply. Desi, there is not currently a website or anything that houses these questions. All right, select all that apply. Okay, so I'm seeing a lot of A, C, and D, A, D, and E. Let's go through it, okay? So a client on furosemide has improved breathing, but now reports my legs feel weak. Okay, so basically, what are we going to monitor as we continue to diurese this person? So this is a good example of a question where we are going to evaluate, okay, because something was done in the question. Now we need to evaluate the effectiveness of it. So let's look at A, magnesium. Okay, that is part of the correct answer set. So magnesium loss can contribute to weakness and dysrhythmias. So we need to keep an eye on it, all right? Normal mag levels around 1.7 to 2.2, all right? B is also correct. Respiratory status reflects congestion, improvement, or deterioration. So B is correct. C is also correct. Weight is the most objective indicator of whatever their net fluid loss or gain is, okay? So A, B, and C so far. And then D. D is also correct. So urine output reflects response and perfusion status during diuresis. Okay. E is not. E is incorrect. Okay. So skin turgor is a weak age variable marker and it should not be used on its own. Okay. Right. Emily said there, like it should not be used on because it says alone. All right, there. Maram set the goal 40,000. Let's see, you guys. Oh, you guys could totally do that. I think you guys get the last live. You guys had gotten like 10,000 in like 4 minutes. I'm like, your fingers must be insanely tired. All right, let's do 37 here. Let's do 37. Okay. A client prescribed warfarin says, I'm starting a new herbal tea cleanse. Which question is most important for the nurse to ask next? All right. Yeah. Yeah, that seems reasonable, guys. Yeah, we're going to say, hey, what exactly is the tea and are you changing your diet? Because warfarin interacts with many herbs. Many, okay? Many herbs, supplements, diet changes, okay, especially if they're going to vary their vitamin K. So, yeah, we need to identify ingredients and any changes that they're going to be making. Yeah, that one was easy. That one was easy, okay? All right. Client arrives after taking extra blood pressure pills because they felt stressed. Okay, the client is dizzy and weak. Which assessments should the nurse prioritize? Select all that apply. All right, select all that apply. Princess Arsena, thank you for the follow. All right. This is a select all that apply. All right. I'm seeing A, B, C, and E and A, B, C, and D. The majority of you, it appears, are settling on A, B, C, and E. Let's see. A few A, B, and C's. Okay, so let's go through. All right. Which assessment should the nurse prioritize? A. Okay, yes, definitely. I think everybody agrees A is part of that. So overdose can cause hypotension. Okay, so we need to trend that. B is correct. All right, many cardiac meds affect rate and rhythm. Okay, and conduction. So we need to monitor that. C is also correct. So LOC, perfusion markers, detect shock physiology early. So we need to keep an eye on that. D is wrong. Okay, sodium intake is not the immediate priority, okay, with a suspected overdose. All right, and then E. E is correct. All right, so the correct answers are A, B, C, and E. So for E, right, exact dosing determines toxicity risk. All right, and it's going to help guide treatment decisions. Okay, so good job to you guys. Okay. All right. 39. Hannah, thank you for the follow. Okay. All right. D. Looks like that's what y'all are rolling with. Let's see. A client on new nitrate says, I've had a headache since starting it. Which teaching is most appropriate? No, I am reading the wrong question. A client with chest tightness is anxious and says, I can't breathe, but SpO2 is 98% on room air. The nurse notices the client's tachycardic diaphoretic. Which action is most appropriate? Y'all are saying D? And I would agree. Yes. D is going to be the most correct answer there. All right, so normal SpO2 does not rule out ACS. Okay, the safest approach is to treat this as some sort of possible cardiac ischemia, all right, while supporting breathing and collecting any sort of high yield data. Okay. All right, let's keep rolling. We got 8 minutes. Let's see if we can't get through some more here. All right. Y'all are crazy. Y'all are trying to get to 60. Oh, because you blew your 40K out of the water. I knew that was going to happen. All right. I don't know if you guys can get 60. That seems like too much. Not me challenging you guys. All right, 40. Let's see what 40 does. Okay. A client on a new nitrate says, I've had a headache since starting it. Which teaching is most appropriate? Yeah. All right. Yeah, that one's easy. That one was really easy. All right. For sure, A, nitrate headaches are common. Why? Why are they common? Due to what? All you little smarty pantses who are like, oh, the question's too easy. Nitrate headaches are common due to vasodilation. Okay? Teaching must focus on safety. Okay? And the high-risk interaction with those PDE5 inhibitors. They can all cause profound hypotension. All right? And we're definitely not telling people to take nitrate with alcohol to reduce headaches, okay? Not a good idea. You'd like to keep your license, okay? All right. Alcohol can worsen hypotension, so we're not going to do that. All right. Let's see. 41? Let's see. I think I only set up 45. So, all right. Ooh, a client on a DOAC says, I missed a dose yesterday, so I took 2 this morning. Which instruction is the highest priority? Let's see. Somebody in the chat, drop what DOAC stands for. For those who don't know. What's a DOAC? Yeah. See, that would be helpful. Okay, does anybody in the chat? Okay, we've something anticoagulation. Yep. Dragon's like, I don't know, but the answer is E. You're right. The answer is E. Yes, there it is. Twain says it's a direct oral anticoagulant. Okay, think like apixaban. Okay, rivaroxaban. So that's your Eliquis and Xarelto. Okay. So yeah, direct oral anticoagulant. So double the dosing increases bleeding risk, right? So DOACs have specific missed dose rules depending on the agent and the timing. So teaching must emphasize the correct protocol and bleeding warning signs, right? Like we had a question earlier, black stools, severe headache, unusual bruising. So those are the things that we need to educate our patients on, all right? Especially if they are, maybe I'm an ER nurse. So a patient coming in with a new stroke and they're going to be ending up on on Eliquis when they leave there, apixaban. So they've never taken it before. All right, so what do? You definitely got to teach them about how to take this medication. All right, 42. All right, a client with heart failure is started on spironolactone. 2 weeks later, the client reports weakness and heart feels fluttery. Which lab is most important to the nurse to review? All right. Yep, absolutely. Yep, the answer is potassium. The answer is always potassium. All right, 43. A client arrives with sharp chest pain that is worse with deep breaths and improves when leaning forward. Which action is most appropriate next? Which action is most appropriate next? All right. Yes, good job. So the answer is going to be B, obtain a focus assessment. So the pain pattern suggests that there's some sort of pericardial involvement, right? So the nurse must confirm stability, rule out ischemia red flags, and watch for any sort of complication cues, okay? So focus assessment is the safest next step, and that's all this test is testing you on, is how to be a safe nurse, okay? That's all it wants you to do. Be a safe nurse. Wow, y'all are crazy. How are you? You guys are at 60K. That's wild. You guys are crazy. All right, let's see. See if let's do one more. Select all to apply. All right, this will be the last one. Thank you guys for the follows. Thank you guys for all the likes. If you are interested in a custom NCLEX study plan, stick around. Okay, that'll be the best $25 you ever spent if you're studying for the NCLEX. Okay, so stick around. All right, Renee, thanks for hanging out. Offie Sam, thanks for the follow. All right, yeah. So if your NCLEX is between, roughly about 2 weeks and out, let's talk a custom NCLEX study plan here. Okay, so for select all that applies, the NCLEX score does give partial credit for select all that applies. Okay, so it's important to use a strategy like the one I teach y'all, is to read through these and make each one its own true-false question. Okay. If any of these answers is not 100% true every single time, throw it out. Okay? Throw it out. All right, so the answer here is A, B, C, and E. All right, so the only one that is not correct is D, and that is because anticoagulation does not eliminate monitoring and assessment needs, okay? So some agents still require periodic renal function checks, okay? And ongoing safety surveillance, okay? What are y'all saying? But don't select the wrong one because they will take a point off. Yeah. All right, but at least it's not all or nothing, okay? So treat each as its own true-false, okay? And that will help you out. So, all right, there's 337 of you in here. Okay, we will pop this down. All right, Emily, yes, you're welcome. So under SATA instead of over, so under SATA instead of over picking, I would say stick to the rules of when you're looking at these answer choices. If you feel that one of them, you're reading an answer, is not 100% true all the time, throw it out, okay? It's not under select versus over select, okay? Sometimes there's 2 answers, sometimes there's 4 or whatever, okay? Don't get stuck on balancing it, okay? Okay, so Troy, yep, absolutely, man. You are welcome. All right, for those of you sticking around, any of you currently interested in a custom NCLEX study plan, I'm going to show you how to navigate to that through my profile here. All right, so from my profile, all right, you can go to the my little picture up there, and that'll take you here to the link in my bio, which you will click. And then from here, we have this is the button you'll press to fill out the form for the custom NCLEX study plan. All right. And then these are a few testimonials of some people who have ordered plans and then send me some awesome DMs. I love getting DMs from people who have used the plans and have passed, or they'll put comments on my videos. So I love to be able to share these things with you guys. And ultimately, the goal is to get you guys to pass the NCLEX, right? Just to get you guys across the finish line. So that would be there. We'll go through that. And then also is the NCLEX Vault, which is about 230 pages of cheat sheets and mini quizzes on every single subject, clinical subject within the NCLEX, okay? All it is your name, email, access now, okay? For the custom NCLEX study plan, you're just going to click that link and then fill out some very basic information, okay? Which NCLEX are you taking? Is this your first time or not? Okay, I do it for both. If it's not, I'm going to ask you for some information on your CPR. Okay, I need you to list out the categories that your CPR says you were above the passing standard and what categories you were below the passing standard. Okay, this will allow me to customize your study plan to your weaknesses. Okay, drop in your test date. This is one of the bigger parts here. Okay, what resources do you currently have access to? Okay, do you have boot camp, okay, or UWorld, whatever. If you have Hearst or something else, just click other and then put it down here. All right, so when in my study plan that I create for you, I'm going to tell you, hey, on Monday, do a 75 question mix set in simple nursing or whatever system you have access to, okay? So, and then any areas that you think hey, I know I'm weak in cardiac, or I know I'm weak in peds, okay? Anything you want to click there or other, okay? Fill that out. You think I have enough time? Yes, absolutely. You take yours on the 25th, for sure, all right? Usually I use 2 weeks as a reference point, all right? So yeah, you have 24 days. That's great. So that's a perfect amount of time. And then I also customize it to actually how many hours you have available to study. Okay. So I know your weekday hours of availability might be different than your weekend hours of availability. So tell me how many hours a day realistically you can study. Okay. And then what days of the week are you available to study? Maybe you can't study Fridays or you can't study Sundays because you work or whatever the case may be. Let me know what days of the week you can study. I can even give you some strategies for test anxiety if your test anxiety is bad. And then bottom here is literally anything else that I would encourage you to really be thorough with this, okay? And put in there what things specific to you. What have you tried already? What has and hasn't worked? What's your type of learning style? Do you have a support system at home? Anything you'd like to share that would be helpful. Okay. Kata, oh my gosh, that's awesome comment. Kata G says, I passed the NCLEX. I'm officially a nurse. Thank you for everything. Oh, you're so welcome. Okay. You're absolutely so welcome. So happy you're here, and thank you for coming back to tell me that and for us to be able to cheer you on and give you that congratulations. That's awesome. Somebody said, where do you get it? So you go to the study plan, you access it through the link in my bio right here. You click that, you on that page, and then get a custom NCLEX study plan. Okay. And friends.lover, how long? I will get this back to you in 1 to 2 days. Okay. 1 to 2 days. All right. Usually more towards the 1 day. So 24 to 48 hours, but usually more towards the 24 hours. Okay. Cassie, when do you do another live, with NCLEX questions? So, I do them Sunday, Tuesdays, and Thursdays at 9 p.m. Eastern. So Tuesday's live is going to be more question strategy, and then also some case study examples. All right, and then Thursday's live on February 4th is going to be med-surg. Okay, this is going to be like this one, which is just as many questions as we can get through related to med-surg. I do questions on every live, even the question strategy live on Tuesdays. There's examples worked in there, but the heavy questions days like today are Sunday and Thursday. Okay? All right. Melissa, if you're a repeat tester, which CPR do we go by? Your most recent one? Okay? So definitely go by the most recent CPR. That's going to have the most current weaknesses based on your last attempt. Okay, good question. All right. Absolutely, Cassie. You guys are very welcome. Any other questions? Anyone else? Any final questions on study plans? Anything at all? What have you got? All right. All right. Let's see. Hold on. My test is on March 5th. Would you suggest buy both boot camp and Archer? What I would suggest would be to buy one. All right, and then really dive deep into it. Okay. I would say this is not me just plugging my stuff, because I legitimately feel like a lot of folks will just buy resources and not really have a means or a plan to use them as efficiently as they can. So what I would recommend would be to pick one, Archer or boot camp, okay, and then allow me to create a plan for you, okay, to help you utilize that resource as efficiently as possible, okay? So I can give you a plan Sunday to Saturday with what to study and when, okay? So again, you can find that in the link in my bio there, okay? Yeah, no, good question. Yeah, I score very high on Archer readiness. That's great. That's awesome. Keep it up. Keep it up. All right, that's all I can say. Brittany, I found out I failed. I'm not sure where to start. I'm sorry. That sucks. It feels like you're having your heart ripped out and that you're like, oh my gosh, I'm never going to be a nurse. But I promise you, you will be, as long as you stick with it. Okay? I promise you will be a nurse as long as you keep moving forward and stick with it. Again, it's just a detour. Okay? You'll get there. I also didn't pass the first time either. Okay? But just keep going. I'm happy to work with you and help you create a plan to get you coming back at this test stronger and more confident. All right, on your second try here. Let's make the second try the last try. All right, so you can do that by going to the link in my bio. All right, and then clicking Get a Custom NCLEX Study Plan. All right, I will get that back to you in 24 to 48 hours. All right. All right. Yep. I know the anxiety is, I mean, you wouldn't be a human being if you didn't have nerves. You know, this is probably one of the most important tests you've ever taken. But just over prepare. Okay. Remember to breathe. All right. Especially when you get there. Listen, I have a video pinned on my profile. It's me. It says POV, you're about to take the NCLEX. Okay. If you're taking the NCLEX this week, you need to watch that video. Okay. It is pinned to the top of my profile, and it's a message I think you need to hear. Okay. Melissa says, how long are your study plans? They come out anywhere between 6 to 8 pages. Okay. Because I feel like the majority of the study plan is telling you how to use the study plan. Okay. How to organize your mislog, how to organize your rule book. Okay, those are 2 things that I will have you create as you're studying. Okay, to track your misses, to better remediate, to create rules for yourself that you review periodically, like 1-sentence rules. So they are Well, all I can say is I get a lot of feedback, and I get DMs every week from students who pass using the plan. And so you feel free to check it out. If when you go to the link in my bio, you can see some testimonials at the bottom. Oh, Melissa says, I'm sorry, I mean, are they 2 weeks, 4 weeks, etc.? So, Melissa, they're completely tailored to you, okay? So if your test date is 27 days from now, the plan's going to be for 27 days. It goes up until your test date, whatever that is, okay? Again, that's why they're customized. They're not just cookie cutter. Here's your 2-week plan. Here's your 4-week plan, okay? It is very specific and tailored to you, the individual, okay? All right. So I think that's 74,000 likes. Y'all are crazy. All right. Well, I'm going to head out because I worked today and I have to work tomorrow. So on that note, I hope you all have a good evening, and I'll see y'all back here on Tuesday, where we will be doing some question strategy and case study examples. All right. Until then, adios. I am Nerd.